So it's my pleasure to introduce Dr. Sean Nash. Dr. Nash graduated from Tufts last year and joined us for the year. And he is going to be talking about rabies, so the title is Rabies, is it really that bad?
Bear with me 1 second. All right, so every year at Genesee, the intern has something that sort of becomes their thing during the course of the year. And unfortunately this year, mine has been rabies. So I was going to talk to you all a little bit about rabies and what it is and is it really so bad? So the first question we have to ask is, what is rabies? It's a neurotropic zoonotic viral disease, which is a lot of words that basically means it's a virus that can be passed from humans to animals back and forth and has an affinity for the nervous system. And it causes, so it goes straight to the brain, basically. And it causes swelling in the brain, or encephalitis. It can infect any mammal. Most of the cases that we see in the United States are in wildlife, specifically skunks, foxes, raccoons, bats are a big one, and oddly groundhogs, which is what this guy's doing up here. But it's mostly wildlife, and that's where the most of the disease is in our country, but we certainly see it in domestic species and even humans as well. So the next thing we need to know is, how is it spread? Transmission, as most of you know, is generally from saliva, most commonly from a bite wound from an infected animal. And it's actually a really cool virus in a terrible sort of way. Once you get bitten with the infected saliva, the virus finds its way into your nerves, and it does something called retrograde transport, which means that it can follow your nerves directly up to your brain. It takes a really long time, and so if you're lucky enough to be bitten in, your foot, or your back foot if you're a horse, you have a lot longer before it gets to your brain than if it's on your face, for example. But it's a pretty interesting way that it travels through your body. So most of the time it's saliva. Now and again there are reports of infection through mucous membranes, through even in the human medicine there's a couple rare cases of organ transplants that have caused rabies in human patients, which is pretty terrible, and they do a lot more screening for that now, of course. And brain tissue itself can be a risk. Other things that you might worry about with wildlife in your area would be feces, blood, urine, and none of those are any risk, so that's a good thing to know. But so then the real question, is it really that bad? And the answer is yes. In humans, initially, it starts out just like a flu, with kind of vague signs, and it progresses very rapidly to sort of disorientation, agitation, the foaming at the mouth that we all think of, or the hypersalivation, of course, is a big one. And then one that's pretty odd is hydrophobia, or fear of water. And those are kind of the classic signs, but rabies can really look like anything, and that's one of the things that makes it so difficult to diagnose. Sort of the good thing is that the acute clinical disease only lasts for 2 to 10 days, and that's because that's as long as you have, and then unfortunately you die. There are very few reports of humans that have recovered, and most of those are in humans that are vaccinated. So it's a pretty serious disease and something we need to do everything we can to prevent. So the next question that a lot of people wonder is, my horse is never exposed to any wildlife, do I have to vaccinate? And the simple answer is yes. It's very rare in horses, fortunately, but the consequences, as we already talked about, are very great, basically death in a horse, and very easily preventable. We know that vaccines are highly effective, the vaccines that we have. And down here, these are some of the signs that we often see in horses. They'll even present as a colic sign, so it really can look like anything. Sometimes they'll see the aggression, like in this picture here. They can foam at the mouth, but it really can look like almost anything. So whenever a horse is acting even a little bit funny, especially if they're not vaccinated, it has to be one of the things that is top on our list of rule-outs. And so then the next thing that a lot of people think is that, oh, well, it's not really in our area, I've never heard of anyone getting rabies. But actually there's a lot of rabies, even just in New York. So just in the last year, and this doesn't include the last couple of months, there were 320 cases confirmed in New York. None in humans, fortunately, but still quite a few, and that's down from the last couple of years. 2 years ago, we were up at 500. during the year, so quite a lot. Most of these, of course, are in wildlife species, but we do see it in domestic animals. Only 13 last year, which is great, and a lot of that's because of how well we're able to vaccinate. And then down the side there, you've got some columns. You can find whichever county you may be in, but a fair number right in our area. And we had, in our practice in the past year, one horse that with a confirmed exposure that was fortunately vaccinated, so that horse did fine. And the reason I said right at the beginning that it's sort of unfortunately become my specialty is that I've had to sample 5 different horses. All of them were negative, but quite a lot this year. So something that has been kind of on our radar, and it's definitely a scary thing to have to do. And the reason is that if we have concerns over exposure, there's really no treatment. There's nothing in horses that we can do to get them through the disease if they have it. So we're sort of tied legally as to what our options are. If they're exhibiting signs, oftentimes it can be quite scary, and there's not even any way to handle the horse or be near it without risk to the humans. So oftentimes they will have to be euthanized. Quarantine is an option for short periods, but it's pretty difficult. And sort of whatever you're going to do depends on the situation and if they're vaccinated or not, but it's pretty serious. And a lot of the time we do end up having to euthanize them and then test them. And that's the really unfortunate part about this, is that there's no way to test an animal or even a human very effectively for rabies prior to death. So they have to be euthanized, and then we have to collect samples of the brain in order to test for it. So it's a pretty gruesome process in the horse. This is me and Dr. Ayers all dressed up for collecting some rabies samples, so it's sort of full hazmat suits. Like I said, there's risk because we're exposed to the brain, so we have to be extra cautious. And then this here is a cross-section of a horse's head. You all may or may not be surprised to see how very small the horse's brain is up here. This is its whole brain. And this small section that says number 31 up there, I don't know if you can see, but it's this very back portion. That's the cerebellum, and that's the part of the brain that the virus goes to first. And so that's the part that we need to collect. And you can imagine this is very difficult. We have to go in through the back of the skull. It's very gruesome. It's not something that we like to have to go through. It's not something that anyone wants to have happen at their farm. But unfortunately, legally, we are required to do it. So that's kind of the gruesome, ugly picture of rabies and what it means, and why you should vaccinate. All right? And this is it doesn't usually spread to plant life, but I guess it can happen. Any questions? Yeah.
I've had a couple of issues with animals that I suspected being bred on my farm.
Okay.
And for spread this time, attempting to contact anybody that needs care.
Okay.
What should I do?
You should, so, sorry, her question was she's had a few concerning cases at the farm and has had trouble finding someone to help you out. Is that right?
Yeah.
So the first thing you should do is contact your veterinarian and contact the state public health office. They have an office that's dedicated mostly to rabies testing. But I'm guessing you did those things.
I did, and they just asked me, did it bite anybody? I'm like, well, it's not yet. And it's nice to kind of hung up the phone on me.
Then I would say call your vet, have them out, and we'll see what we can do. We're always willing to help you out. Like I said, we don't like having to do this, but we take it as a very serious part of our job because of the human health risks. But yeah, it's definitely scary. I hope those ones turned out okay.
I shot some berries.
Okay. Everyone's healthy, I hope?
Oh, yeah, we're fine.
Okay, good. All right. Okay. Yeah.
A lot of feral cats in the area.
Uh-huh.
It's an alternative, many of those.
Yeah, and so the largest percentage of that domestic species that I listed is in cats, and a lot of them are in feral cats. I don't know how they do all of the testing. Certainly, the public health officials, any cat that's reported as being suspicious, they will attempt to trap, and then they unfortunately have to be euthanized and tested. That's pretty standard protocol. The other thing is, I don't know in your area, but a lot of areas will have sort of trap and release programs for vaccinating, which I hope you have, and hopefully keeps some of that population down. But feral cats are definitely sort of a reservoir of the virus. Yeah, it's tough. But trap and release is a great thing that we can do to help get some of them vaccinated and neutered as well. Yeah?
Are mammals the only reservoir?
Yes, it's mammals only. Reptiles, etc. are free of the virus. Yeah?
We had a cat who on 2 occasions has been in contact with vets and we've taken him back to the vet for research.
Yep.
If you think your horse has been in contact with any booster shot?
Yeah, so the question is if you have concern that your horse has been exposed, the first question we have to ask is whether or not they've been vaccinated already, and it sounds like they have. If they've been vaccinated already, then we just want to come out and give them a booster, just like with your cats. If your horse has not been vaccinated, that's when it gets a little more of a gray area, and that you're talking more about quarantine in those circumstances. Yep. Anyone else? Yep.
How often does the horse have to be vaccinated?
That's a great question. The question was, how often does your horse have to be vaccinated? Right now, horse vaccines for rabies are yearly. That's the way that they are labeled, and a lot of people ask that because they know in small animals, dogs and cats, there are 3-year vaccines. Unfortunately, we do not have that in horses because there hasn't been the research. So right now, we have 1 year only. Okay? Anyone else? Yeah.
If you have a rabid animal in the barn and
Yep.
there's saliva on, say, a board or something,
Mhm.
once that dries, is that area safe? Or is it-
Yeah, the virus is pretty short-lived in the environment. I don't have the time off the top of my head, but quite short. But we still recommend sort of dilute bleach on everything to kill the virus, but it doesn't survive well on its own. Yeah. Yep.
Why can't I get vaccinated myself and feel better?
Because that's what the state says. And you know, I don't want to get into it too much, but there are people who do vaccinate themselves for rabies, and that way you know it's been vaccinated. The problem in those circumstances is that the state requires a vet do it, and then if you run into trouble, the vaccine that you do at home won't cover them legally, and so we still have to do the testing. And so that's just kind of a state mandate, unfortunately. Sorry. Yeah?
Can you talk about rabies titers and why you think it used
So the question here is about rabies titers. We certainly can do rabies titers, and we do. They take a while to get back. One of the problems with the rabies titers is that we don't have a lot of good research to back up what levels should be. We know that they can be really high or really low, but it's those in-between areas that become a little more gray. And that's part of the problem, is that we just don't know when it's okay to wait and when it's not. And then the other problem with the titers is that even if you have a titer, the way the legislature is set up at this point, if it hasn't been vaccinated in the last year and it's showing signs, we still need to test. So we can do the titers, and certainly there are rare instances, horses that have bad vaccine reactions or something like that, where we can do titers instead, and we can write letters to the state and those sorts of things. But generally, we just don't really have the science to back it up. Yeah.
Once you vaccinate, how long before immunity is in the
The peak sort of immunity is in about a couple weeks, but it's a great vaccine and lasts really for a full year quite well.
Okay, I know more people have questions, and